I couldn't have said it better myself. So I also wanted to thank Mika for her candor and her inspiration in sharing her story. I think part of bringing an event like this to campus is the ability to reduce some of the stigma in talking about eating disorders. And I think we are fortunate to have the passion of Chairman Emeritus Ramsey in helping us bring this event to campus. So we thank everybody involved. I have the distinct pleasure of moderating our panel today. My name is Melissa Napolitano. I am on the faculty in the School of Public Health and Health Services, and I'm also a trained clinical health psychologist. And so I view eating disorders from both a public health perspective and also being on the front lines in terms of treatment. And so the format for today, our panelists will each introduce themselves, and then after two of our students share some of their stories, we'll open the forum up for questions.
Hi, my name is Isabel Goldenberg, and I'm the medical director of the Student Health Clinic here at GW. I'm a pediatrician by training, and I did a fellowship in adolescent medicine. So through my many years of helping patients, I have been in contact with many patients with eating disorders.
My name's Katie Duman. I am a junior here in the Columbian College of Arts and Sciences, and I'm minoring in public health.
Hi, my name is Nancy Cass. I am a licensed clinical social worker and a staff clinician at the University Counseling Center. A new addition to the Counseling Center, I'm the Eating Disorder Services Coordinator.
Hi, my name is Laura Porter. I'm a junior in the School of Media and Public Affairs, and I'm the president of a group called Students Promoting Eating Disorder Awareness and Knowledge on campus.
Hi, I'm Mark Levine. I'm the Senior Associate Dean of Students. Thanks all for coming. Nice to see the students staying. It's an important part of the conversation. I've been here for close to 19 years, and having worked with a few panels through the years on the topic where we'd get 10 or 15 students, which was great. It's nice to see more than 10 or 15 students here. This is wonderful, so thanks for being here.
Great. So you can see we've really assembled a panel to speak both from the student side and then also some of what our administration is doing to really address both resources and awareness on campus. As I mentioned, both Laura and Katie have bravely agreed to share some of their stories, again, which I think can bring a little bit more focus and awareness about talking about some of these issues. So I'm going to turn the floor over to Laura to get the conversation or continue the conversation.
So like I said, my name is Laura. I'm the president of Speak GW, which stands for Students Promoting Eating Disorder Awareness and Knowledge. And I've also struggled with an eating disorder. It started really in high school. I had trouble fitting in, had trouble making friends, and I turned to an eating disorder. I thought if I looked a certain way, if I weighed a certain amount, then everything would be okay. And so I started running about 3 times a day, and then when I got into college is when things started to get worse. I started purging about 5 times a day and went on for a year. Just things progressively got worse. My weight was dropping, and I knew that I was going to kill myself if I didn't stop. I knew that I probably wouldn't make it to the end of college. So in what was supposed to be my sophomore year, I went into residential treatment, and when I entered in, I just found this kind of community in treatment. It's kind of funny to say, but these people, the women I was with, just understood what I was going through. They could relate to me. They knew the anxiety that I felt, the loneliness that I felt, and they weren't afraid to talk about eating disorders. And so I was in and out of treatment. It was residential, so I was in and out for about a year, because recovery for me wasn't, and I think for most people, isn't a linear process. It's an up and down type thing, and I would relapse and then go back into treatment. And but I got out in about a little over a year ago. I got out of treatment. And then once I got out, I went back to GW, kind of reacclimated to everything, and was really missing that community that I felt in treatment, the community of people who would talk about eating disorders. And so this past summer, I was like, what can we do on campus to bring the conversation to the forefront? So I actually met with Mark, and Mark pointed me towards Speak and said there's this great organization. And I said, this sounds awesome. And so when I got involved in that, it really helped me use my voice. For so long, the eating disorder was a way to speak. I spoke through my physical body, trying to show people how horrible and how sad I felt, trying to show people on my outsides what I really felt on the inside. And now I really hope that I can use my own voice to help others speak too and know that they're not alone. And I think it's really important. One of the main reason I want to tell my story is because I felt so alone at the worst parts of my eating disorder, and I want people to know that it's not something you have to be ashamed of, and that it's not something you have to go through alone, that it's something that I think we all need to talk about as a community, and that it's something that you don't have to suffer with in silence. So thank you.
My name is Katie Duman. Like I said, I'm junior here also. I would technically be a senior, but I also have been in treatment, taken some time off, whatever. I'm the vice president of Speak. Laura came to me last fall and was like, oh, I'm kind of thinking of restarting this org. And I was totally on board. I have struggled with an eating disorder since about the age of 13. It started innocently enough as, wanting to be healthy, whatever. And quickly went downhill. I think all throughout high school, I was not myself. I don't think I experienced anything that any of my friends did, or friends. I don't think I really had friends. It would be the people I maybe hung out with sometimes. I was constantly concerned with food and exercising and controlling those two parts of my life, which I felt like I could control. My gracious mother, who is here and is the only reason I am where I am today, pushed me into treatment and seeing therapists, and I was all like, I'm fine, it's whatever, like I'm great, and no one could do anything for me because like I was totally fine. And I think Laura would agree, and Nancy, that fine is a really, really lethal word for anyone in these circumstances, because no one can help you if you're like, oh yeah, I'm fine. What are they going to do? And I think that's kind of a large part of my story is I've always gone through being like, I'm fine, whatever, it's cool, like I'm just living my life, it's fine, which it totally wasn't. Like I said, I spent about 8 years of my life not having friends and worrying solely about food and exercise and thinking about that 24/7. So like I said, it went up and down in high school, and I saw a few specialists. It didn't really do anything. Once I got to college, it quickly went downhill. The first semester of freshman year was definitely rough. I still, wasn't acknowledging that I had any sort of a problem. I knew that my parents knew something was wrong, and that was annoying. They wanted me to do something about it, and again, they made me go see someone. I was like, whatever, it's cool. My weight had gotten really, really low, and I was clearly very sick. I can look back at pictures now, and it's frightening how I didn't even notice it then. I thought I was totally fine. And it was at the end of freshman year here that I was kind of given the ultimatum by my parents that you're either going to go to treatment or, face it, you're not going to finish school, you're not going to survive. So I went into day treatment actually out in Bethesda at the Renfrew Center, and I was still in classes here, so I was a part-time student doing that. And that was kind of the first time I kind of accepted I had a problem, I think, and started to submit to getting help and telling people what was wrong. But like Laura said, it's not a linear process, and I think that was just the first step for me. So I went through treatment that spring, and I actually was back in an intensive outpatient treatment in Bethesda just last fall while taking 5 classes here and working, so that was rough. Taking it a little easier this semester. But I think, like I said, I have learned that it's a process, and especially I think last fall was really a turning point for me. I've learned how much work it takes to go through this, and I think for anyone here, and I think one of the things Laura and I would like to help people with and to help promote awareness about is that it's not just some little thing that 3 people may deal with. It affects so many people, and it's a big deal. It's not some simple little whatever. It takes a lot of hard work and energy and motivation and courage and sometimes persistence and just kind of being mechanical about it because you don't really want to do it. But like I said, I think I think that's one of the things that people don't know as much about this issue, and I think having gone through this experience of doing it at school and kind of having to get treatment and figure out how to live, I've realized that it takes a lot, and if I can share that with other people and say, hey, look, it's possible. No one around me thought I was going to even finish college after freshman year, and I'm going to graduate in December and have never been happier with where I am in my life. And I think people need to know that, because if 4 years ago or whatever, I was sitting somewhere, I never would have thought any of it was possible. I was concerned about my eating, and that was it. And that consumed my brain 24/7. But with hard work, it doesn't have to. And that is what I would like to help other people find out in whatever way I possibly can.
Thank you both for bravely sharing your stories and talking with us a little bit about the process and how you ultimately entered into treatment and are well on your path to recovery. One question that I have for you, and then we'd like to open the floor up for other questions, is it sounded like your family and friends were very helpful and supportive in encouraging you to get into treatment. Can you talk a little bit more about what was helpful and perhaps maybe what was not so helpful in the journey?
Yeah, I think it's really difficult, and I think one of the things people don't understand that one person being sick does affect an entire family, and I've also witnessed the sister deal with this stuff, so I do know how it is from both angles. And I pushed my family away so much. I still have a hard time understanding how it is that they still support me and love me, because I didn't give them the time of day for years, and they tried to help me, and I was just completely oblivious. But like I said, that was the only reason that I am where I am today, because I was totally fine all the time, and it was my mom who was like, no, you need help. So for me, like I said, it's been, that was what pushed me into treatment, and then even going through it and kind of going through the ups and downs and going to treatment and then going back to treatment. Like, it's obviously not fun for anyone, and if I was, in my family's position, it would be like, oh, great, again, like, is it ever going to get better? But they're always there and kind of remind me what I need to do and get to. And like I said, if it wasn't for them, I wouldn't be here. So that kind of is the bottom line.
I think that the best thing, and this can go for friends as well, but the best thing that my parents told me was that they were proud of the steps that I was taking, because when and I'm sure Katie can speak to this too, but when I was my own worst enemy, just having someone tell me that they were proud of what I was doing was huge. And I will say this, for taking the first step to decide to seek help, that would be the hardest, and that I think anyone who takes that step deserves a lot of praise. And I'm so grateful that that's how my parents supported me. That's what I would say was the best thing that I could have gotten, was we're proud of you.
We're all proud of you both for being here. So I'd like to open the floor up to questions. If folks have any questions for any member of the panel. And while we're waiting for folks to come up, maybe Nancy, you could talk a little bit about some of the myths and facts surrounding eating disorders. Particularly, we know there was one of our previous audience members who talked about his struggles with eating disorders. So we know that eating disorders can affect both males and females. And so maybe Nancy, you could speak a little bit to that for us.
Yeah, sure. I think probably the most common misconception is that an eating disorder is just about food, and it's absolutely not just about food. I think we say a lot of time it's about the food, but it's really not. It's about emotions, and an eating disorder is a coping skill, first and foremost. Just like alcohol is, drug use is, OCD is, all these other coping skills that we're aware of. And what it does is it exists to help a deeper rooted issue of typically anxiety and depression, oftentimes stemming from physical, emotional, or sexual trauma. And when we say the word trauma, we're not necessarily meaning something life-shattering that's happened to you. Trauma can be your parents divorcing. Trauma can be you moving from somewhere and feeling like you don't have a support system. Trauma can be a breakup. Trauma can be a medical issue that happened. So an eating disorder, as I believe Laura was kind of saying before, it speaks for you. it shows other people what's going on because you can't. You can't speak for yourself for some reason. And typically what an eating disorder does is it kind of causes a fissure in a natural development of somebody, a little bit of an earthquake, so that where we normally learn to talk about our feelings, and I think and I feel, we're not able to do that if we're struggling with an eating disorder, and it comes out in different ways. So I think first and foremost, that's a big misconception. The second would be what you just touched upon, is that it's not just an issue that affects women. It's not just an issue that affects young women. I worked at the Renfrew Center in Manhattan for over 4 years, and I worked with, the Renfrew Center is only women, but I worked with 15-year-olds to almost 70-year-olds. This is something that affects the entire life cycle. And there are a lot of men that are struggling. There's no catch-all for someone with an eating disorder. So it affects everybody. And there's an eating disorder, and there's disordered eating as well. And I think we kind of use the terms interchangeably, but there is a difference. I think a lot of people can struggle with disordered eating and those times where they're just kind of feeling like they're emotionally eating. And then there's a full-blown eating disorder, which is very different.
So I could ask questions for hours, but I want to make sure that please come to the mic and share either your experience or your questions.
Hi everyone, my name's Misha, and I am a junior at GW, and I am with Laura and Katie on the board of Speak. And speaking as a male, I had a question, but I also wanted to offer some background. I actually used to be pretty overweight, about 50, 60 pounds. I was close to 220 as a person who was 5'10". And I decided when I came to college that I needed to change that. And so I started eating much better and exercising. And for a long time, I was seeing some really great results. And then I just kept getting results, and that was the problem. I got to a point where in a week of 7 days, I was losing 7 pounds. I was going from 177 down to 170, down to 163, down to 156. And I was like, this is the best thing ever. And then I kind of realized, I don't really know how to stop this. And it was a really hard thing to get myself to say, okay, stop, and we need to start creating a more normal eating pattern and a more normal exercise pattern. And I mean, it's definitely something that I still struggle with a lot. And I remember at my unhealthiest last year, I was right around 150 pounds, and a healthy weight for me is around 165. I would eat 1 full meal every 2 days, and I would have peanut butter and 2 rice cakes on the days that I didn't normally eat, or a salad. And that was obviously just really messed up. But in joining Speak, I've kind of noticed that there's a lot of, I don't want to say rhetoric, but there's a lot of wordings that don't really work as well on me, possibly because I'm a male. And I think that the idea that eating disorders don't only affect women is something that's just burgeoning in the last 4 to 5 years. So what is being done to kind of reach the male demographic? What kind of new approaches would be used?
I mean, you. Seriously, I mean, you joining our group, and I think putting a face to it. I mean, where else do you start? I think is something, and having someone say, look, I dealt with it too. It isn't only you females that are up here talking about it. I mean, I think bottom line is where you start.
I agree too. I think that I mean, even as women, I know Katie and I have talked about the fact that I talked about it in opening, that it's not really talked about that much. And I think for males, it's even more so. And I think having these kind of conversations and having people who, like you, Misha, who are willing to share their stories and reach out, because, who knows? Even what I tell Katie all the time is, even if I just share my story and it only touches one person, then it's all worth it. And I think that you being willing to share is the kind of movement that it takes, for sure.
I'd probably add, as well as the university, having men to talk to about the issue. I think Greg, as the advisor for Speak GW, is a great example. Myself and others who are here to talk to students, and there are lots of us, hopefully helps as well. So it's not just an issue that women are working on and dealing with and helping others. Other ideas the audience has? Other things that we can do as a university? I think that's a great question.
And Mark, maybe you and Greg could speak a little bit to what the House staff and the university are doing to support and raise awareness and also provide some other services.
Sure. Great. Thanks, Greg. I'll let Greg talk about House staff more specifically, but generally my world is working specifically with UCC and student health. So as we expand those services and add more staff, and by hiring someone like Nancy to bring even more attention to it, that's, we continue to train our own staff. We continue to look at ways to reach students. The CARE Network, which is now really in its second year, is a system we have in place for those that don't know, to bring attention, to bring some help to a student who's needing help, whether that's around disordered eating, support in some other way. We put more systems in place so we can know. I'm really moved by the conversation about it being such a secret. So how do we get students to talk about those secrets? And I think both that network and by staff who are around and available to help to bring that secret out a little more. I think those are just two systems that we use.
And Mark, you've convened a number of working groups with both students and staff and faculty around health and wellness and eating disorders to try to bring everybody together.
Sure, just bringing people to the table. And thank you, Melissa. Just students, faculty, and staff all talking about the topic helps to move it along. It's very easy to get caught up in all the other stuff that's going on in our worlds. I think it's hard enough to be a college student in general. Then you throw this on it, it's just that much harder. So yes, by bringing people to the table to have the conversations, we'll look at the brochures, we'll think about ideas and programs and events to continue to get the word out. So absolutely.
Greg, do you want to speak a little bit?
Sure. I'm Greg Rowe. I'm one of the directors in the Center for Student Engagement. And going off of what you were just saying about staff involvement and the importance of having people that you can approach to, we obviously employ all of the house staff who live in the residence halls on campus, as well as the student organization advisors that work with our almost 500 student orgs on campus. So it's really important that our staff on the front lines have exposure and experience and knowledge about the issue of eating disorders on college campuses. We actually were very fortunate to have Laura and Katie and other members speak at our department's winter training, where we had about 130, everyone from student org advisors to the directors in our department down through the house staff, present in a room not only to hear their stories, but to become educated and knowledgeable about what our campus resources are. I think part of the greatest challenges and one of the things that drew me into caring enough about this issue to really advocate for enhanced visibility of resources on campus was that, with so many staff and students so dispersed around campus, not everything is centralized. There is no one-stop shop that you can go to for information about, well, just about anything. Maybe Colonial Central is the separate piece. But we have made major leaps forward with the addition of Nancy to the UCC staff, where we now have a services coordinator that students can identify. They put a face to an office. With committed students in Speak and other organizations who are actually increasing awareness about this mental health related issue on our college campuses, as well as all of our departments informing our staff, working with faculty to ensure that they're aware of the resources, because when people notice and when people can support students in those ways, that's how you make those connections, and that's how you help people understand what you can actually do to get help. But for the longest time, it's been more difficult and challenging to find those resources. But I know Mark and the working groups that we've been on in terms of creating more centralized presence of information on the web, working with Nancy and UCC as their efforts continue to amp up to make sure that we're reaching as many students as possible and starting the conversation. Because I'm sure Laura and Katie can talk to you about the impact that it has. As soon as you start talking, telling your story to someone or sharing what Speak does, what's the reaction that you get from students?
Positive.
It's usually positive, yeah. It's usually like, wow. I've found that when I can talk to people, some people are like, oh my gosh, I struggle with the same thing. And it doesn't have to be like, there are like 3 main classes of eating disorders, but we don't even have to have the same symptoms or the same behaviors. We can relate. I found that if someone else is struggling, I can relate to them on an emotional level, because as Nancy and I both said, it is about the emotions, and I can connect to them and be like, yeah, I felt the way that you're feeling, and I can help you know that you don't have to feel that way, and you don't have to feel that way alone.
Yeah.
And one question that I actually present to the students on the panel, but also to anybody else I would want to answer is, one of the biggest challenges that I've seen is, talking to students who are trying to help a friend, and when you have that initial conversation and are met with that, brick wall of resistance, the I'm fine, the there's nothing wrong, I want nothing to do with you. How would you recommend somebody who is looking to support a friend, a family member, or somebody that they know is struggling to be persistent, to not give up in those circumstances? And if you have maybe an example or something that you could share with the audience about, what that experience may have been like.
I actually, I have an example. One of my RAs freshman year came to me and told me, like, I think you have a problem. I think you need to get help for this. And I pushed back and was like, I can't believe that you actually noticed. I was ashamed and embarrassed and angry that she found out about it, and because I was trying to keep it a secret. But I ended up, her voice kind of stuck in the back of my mind, and it made an impact. It showed me, one, that someone cares, and that, two, other people realize what I'm doing to myself. And I think initially, and Katie can speak to this too, but initially I had a lot of pushback. I was pushing back a lot and was angry and resentful and said things that weren't really me talking. It was kind of my eating disorder defense. And that would be I would say, if you get that reaction and you're concerned about someone, don't stop there. Ultimately, I had to make the decision for myself, but just reaching out and showing someone that you care about them really can make a lasting impact.
Yeah, and I think to echo what Laura said, I mean, it's kind of a fact. There's going to be pushback. It's going to seem like the person hates you. But you have to realize that it's not the person talking to you. It's the disorder inside of them that has taken over them. And I mean, the persistence, like we've said, I think is key. And things that my parents had mentioned to me just about like what's going to happen in your future if you don't get help. Even if I didn't respond with the moment, it did stick with me. And I think you have to go into it knowing that you may lose this person as a friend for a couple months or whatever, but they'll be back if they do get help, if you're persistent in showing that. I know for me, like my family, again, pushed me to get help, and I was like, no, and there's a long period of we all hate each other, but I mean, my relationships have never been better now, so it does come full circle if you just know that it's going to be hard and that you do push ahead.
Are there other questions? Yes, please.
Well, my name's Lauren. I'm a graduate student here, and I have noticed that there's been a lot of sharing of details and numbers and weights and sizes and things that people ate. And I'm curious from all or any of you what your perspective is on the role that that kind of information has in having a conversation, and whether it's useful or detrimental or none of the above, and if it's possible. Yeah, I guess that's it.
I think for me, I really tried to avoid using any kind of details or anything like that. I think it's really about the person. Everyone tells their story a different way. I think one of the things I struggled with in my eating disorder was and I struggle with now, is things affect me, but I don't want people necessarily to feel like they have to walk on eggshells around me. But for the way I tell my own story, I choose to focus on the emotions and that kind of thing. And I think everyone's different in the way that they portray theirs. But ultimately, I think if I look past the numbers and all of that kind of stuff and the behaviors and look to relating to someone and kind of notice the similarities rather than the differences, I think, then I can really catch on to yeah, I was there, regardless of whether our behaviors or numbers matched up.
Mm-hmm. I think it's also just depends on where somebody is at. Yeah. We talked about the fact that eating disorder is about much more than numbers and weights, but that's kind of the starting point. And if that's the first thing that someone wants to talk about, that's okay. They can start talking about the numbers and the weights, and eventually we want to get them to the lower level issues, which are the emotions, which is the pain and the anxiety and the depression. So I think initially it's okay if that's where somebody is at, but obviously we want to direct it more to how are you feeling and what's going on for you. And that would have been my response, Greg, to your question as well, to how to kind of approach somebody is just say, how are you? We can talk about the food, we can point that out, but we can also just say, how's it going? Because that's really what's underneath it all.
I see another question.
Hi, I'm Madeline. I'm a graduate student here. What are some ways as a peer and as a friend that you can kind of distinguish the point at which someone's exercise behavior or relationship with food has gotten to the unhealthy point?
I think that any time that a friend or a family member gets concerned about the way that we eat or we exercise, that may be an indication that there is a problem. Early recognition of an eating disorder really helps a lot into having much better outcome of treatment and recovery. Especially if your peers feel that you are running much more, or that you are eating much larger portions, and then for a couple of days you don't eat anything, or that they never see you eating. If the peers feel that that's different and they're concerned, I think that it's worth exploring it. For the friends, usually that causes anxiety, and there are resources here on campus that you can look for support, like the University Counseling Center, or student health, or organizations like the students. Try to refer your friend to talk to healthcare workers or mental health workers, because eating disorders is a disease. You know, if you have a friend and you know or you suspected that his or her blood sugar was in the 300s or 200, and normally it's 100, what would you do? You will try to seek medical help. The same we have to do with eating disorders. If the friend cannot accept your message, it's part of the syndrome, it's part of the disease. There is denial, there is it's like the perception of your body and the perception of your activities is completely distorted. So if you notice something that is not kind of the normal, what everybody usually does, it's a problem. If they cannot accept it, it's part of the disease. Don't feel that they are rejecting you. It's not that they're rejecting, they cannot hear. It's like they cannot decode your message. The University Counseling Center may give you some strategies to how to reach friends. Student health may give you some strategies, or you may consult if you feel that that particular behavior really gives us lots of anxiety, because we all have a little bit of these problems. Many of us, because of the society or pressures of the culture, we are all concerned, you know, how we look, what size we wear, what is our weight. But it depends what is the degree in which we feel those things. For a group of patients or for a group of students, mainly women, but of course many men, that kind of takes over their life. And they are in need of support, they are in need of treatment, and we have to think that these are kind of long-term problems. And we have here the students that so bravely are talking about their issues, 6, 7 years. Well, if you are 18, so like 1/3 of your life, or you are 20, about 1/3 of your life has been consumed by a medical problem. And perhaps, hopefully, you are in remission, or you are in a steady and good place in your life right now, but it will need continued treatment.
And maybe Dr. Goldenberg and Nancy, you can talk a little bit about the services available on campus and how those services here are coordinated, so that if you are concerned about changes in a friend's behavior, what a student might do in order to help their friend access some services.
Mm-hmm. Well, first and foremost, I would echo what Mark said before about the Care Network, which is just submitting a form online. You can do it anonymously, you can do it not anonymously, just that you're concerned about somebody. And that will cause somebody to reach out to them. That's number one. And number two is go to the Student Health Service. Go to the UCC. Ask for me. I have walk-in hours. They're Mondays and Fridays from 1 to 4:30. Come on in. You know, we're here to help, and we will work together. If there's somebody that's being seen by us and being seen by Student Health, we're going to be talking, and we're going to be coordinating care. So those services are available. There's psychiatry that's available at Student Health as well, because oftentimes, you know, as Mika, I think, was saying before, there's a multidisciplinary approach here, that there's typically a therapist, a dietitian, and a psychiatrist, and a medical doctor that are involved, and we have all of those here on campus.
Is there anything else you'd like to add?
No, sometimes when the freshmen or sophomore, they come on campus, and if they have been in inpatient treatment, it's a good idea and it's very supportive for the students. If the parents come to Student Health, we usually have a family meeting, and we kind of develop a plan of care for the year. Usually the student will have a mental health provider, either at the counseling center or privately, and the mental health provider will be kind of the leader of the team of care. The medical doctors or the healthcare workers at Student Health, we will monitor some of the vital signs, weight, and some other aspects. Sometimes we check for electrolytes, or sometimes we do electrocardiograms. And we also usually have a dietitian working with us. And we communicate, we try to follow up how the student is doing. And in the initial family reunion that we have, we put some goals for the year and some parameters of how much or how little, and you know, how are the expectations for the student and for the family, how that year will be. Of course, the patients, it's up to the students to come to Student Health. It's up to the students to go to the counseling center or give the psychiatric appointments. But it's part of the disease. It's not easy to accept. There is a lot of secrecy. There is lots of shame. And hopefully conversations like this could transform the shame into support.
Mm-hmm. I think it's a great example, as we're talking about co-locating Student Health and UCC together, that this particular topic, the importance of those two areas working together will just be even more seamless than it is now. I think it's a great example as we move in that direction.
Mm-hmm. I think that's exactly right. And in the short time that I've been here at GW, I've seen even more attention being paid to student health and wellness, encompassing both eating disorders and wellness and weight. And I think that there's going to be continued coordination of care, and I think Nancy and Dr. Goldenberg and Mark and the house staff are really setting the stage for students to be able to come in and share and get their friends or get themselves some help and treatment. Are there other questions that folks have? Yeah, please come to the mic.
Hi, my name is Heather. I'm actually getting my MPH in Public Health Communication and Marketing. So I know we talk about the obesity epidemic in this country a lot, and I'm just wondering if how much we talk about it is actually maybe making some issues worse. Right down to, you know, we constantly, I think every week we have a celebrity on the cover of a magazine, like, I lost 30 pounds, and they give the detailed plans of exactly how they do it, and they're also praised for that more than anything else that they've accomplished, even if they've, you know, written a bestseller or they've won an Academy Award. Like, it comes down to they lost 50 pounds. And then on top of that, I'm kind of wondering if this praise related to losing weight sort of makes it a little bit harder along this spectrum of eating disorders to sort of, for people, everyday people, to admit to things like binge eating disorder, slightly less, for lack of a better word, quote unquote, popular eating disorders, because there's a little bit more shame. I think people perceive it as having less self-control. So I'm wondering if those two things kind of tie in together.
I'll take a quick stab at your first and second question. I think first and foremost, when we see some of the media messages, and in particular, I lost 30 pounds in 2 weeks, I think what that sets up is some unrealistic expectations of what is possible, that our bodies really are not that infinitely malleable to make those changes. And I think part of having conversations like this is trying to figure out how we reset some of those expectations. And I know there was a question earlier about the responsibility of the media and how does the media reset some of those. So I think it's all up to us to be active consumers of some of those media messages, because we're the ones who can be on the front lines as public health professionals in changing some of that dialogue. The other question that you have, and then I'll turn it over to some of the panelists, is this idea of what gets reinforced in some of the messages about, as someone may lose weight, there may be some positive reinforcement. And I think, as we know, as a behavior change scientist, we know that reinforcers of any type are going to make a behavior sustain over time. And I think, having conversations like this about what we reinforce and what we reinforce in our peers and in others, I think we all have a responsibility to be mindful of some of that. But Nancy, I saw you nodding your head. Do you want to take some of that too?
Yeah, I completely agree with what you're saying, and I'm really glad that you brought it up, because I think there is, again, so many misconceptions about eating disorders in general, but I think everybody comes from their own standpoint, but my personal standpoint is that obesity is an eating disorder, and it is about something so much deeper. Even when we're emotionally eating, right? We use the term emotionally eating. There's a reason for it. There's something so much deeper underneath it, and I think the conversation needs to go to that and needs to talk about the reasons for it and how this happened and when somebody started struggling with this. And, I don't just want to hear that you lost weight. I want to hear why you started to lose weight and what else did you increase in your life because the food was no longer powerful, right? Did you increase your friends' supports? Did you increase what you were doing academically or professionally? Because the food is playing a role. And I think, we don't necessarily always say disease or always say, an eating disorder isn't necessarily an addiction. I think there's a lot of different terms people throw around, but the basis is that if someone's an aholic, they have an issue with intimacy, right? And if someone struggles with an eating disorder, there's a relationship, an issue with intimacy, and an issue with anxiety and depression and relating to other people. And I think that's what we need to talk about.
And I think that Nancy brings up a really important point. As we all come at eating disorders and have our own perspective, I might respectfully disagree about obesity as an eating disorder. I think there are a lot of challenges that we face, and both weight and obesity is multifactorial. We've got environmental challenges. Mika was talking about some of the reinforcers of salt, sugar, and fat. And so I think we'll learn a little bit more over time about some of the media messages and environment and family and different precursors and trauma, and how all of these fit both into disordered eating and weight and a healthy weight. And so I think this is the beginning of a dialogue that we'll all have. But I charge each one of you to go out with an open mind and be the ones who are making the change in some of the dialogue and making the change in the perception of some of the media messages. So I thank all of our panelists today for a great conversation. I thank all of you for participating. Before we let you all leave, I want to invite Dean Goldman to the stage for some closing remarks.
Thank you. Thank you so much. And thanks to you all for being here today. And especially I thank Ms. Brzezinski for coming to speak with us, and our students, both on the stage and in the audience, who have been so open about speaking out about this problem. I think that it's kind of a trite thing to say, but the first step to solving a problem is to be able to at least admit there is a problem, begin to talk about the issue. And when we allow ourselves to be, if you may, silenced by stigma, when we allow ourselves to be in a place where we're not allowed to speak about this issue, then we're not going to make any progress with this. I also want to thank a couple of people in the audience here who are parents of two of these women who are on our stage for being here today. It's as a mother of a teenage daughter, it's very touching to me to see you here. I should say some of what I heard from your daughters reminds me a lot of my relationship with my own teenager. I mean, it's very hard, to disentangle these issues, but whether a daughter has or a son, has an eating disorder or whatever is going on, there's still also just kind of the pain of the transition for us parents watching our children grow up, right? It's not necessarily that it's painful for kids to grow up. I never experienced that as being painful myself, but it's hard for us to let go. And it's just fortunate that there's this big store of love that's built up over the years that we have that allows us to survive watching our children grow up and then eventually do what you've done here today, which is you have repaid their love just in amazing ways by being able to be here and being able to share your experience with all of us. And I also have to thank, of course, Dr. Napolitano for her work in our school and her willingness to take the time to work with students and to participate in this, as well as the wonderful staff and our student counseling and service and our student health service. I'm just so pleased that we have moved forward in this area to provide these services for our students. And I think we've heard why that's so important. Of course, to Diane Knapp and to Steve Knapp for being so supportive of all of these efforts by our students, by our schools. They are wonderful. And last but certainly not least, to Russ Ramsey and his wife, Norma, who did make a contribution to help us with doing these activities this week. And it is so wonderful also to see somebody like him being willing to, as a man, as a father, to be able to speak openly about his life and the experience that he's had with his own family. And so with that, I just want to thank you all and to leave you with one thought, which is that this isn't the end of this session, but it's really a beginning of some new approaches to being able to address this issue. And I hope we continue this dialogue through this week and on into the future. Thank you all.